Good afternoon, everyone. First of all, I would like to thank the committee for their invitation for us to come all the way here to share our knowledge with you. As she mentioned, I am coming all the way to talk about one of my research, which is about the impact of pelvic floor muscle and yoga training improving 3 women uterine prolapse. I briefly would like to give background why I'm selecting this study. Worldwide, I found a research at 2013 that 25% to 90% of the women, they are impacted by uterine prolapse and can be extremely debilitating and impact the patient quality of life. This is a common problem in aging women. Main symptoms, it is vaginal heaviness, discomfort, especially during sexual intercourse, in addition to urinary incontinence. The physiotherapist, as we all know, it has the first line to patient conservatively if they have the first degree or second degree of prolapse, but if it is more than this, it is very difficult to cure them. The physical therapy will give them special exercise program and a special type of yoga, which I will talk about it in details. In our country, we found the incident of prolapse. It is affected 67.7% according to the last study that was published at 2022. This is a huge number of our population, and when I received a lot of referral for such a patient to treat them, I decided really to make this study to give them a best evidence course of treatment. And they respectively related this to heavy weightlifting, and multiparity were found as the risk factor of the prolapse. Urinary prolapse is a healthy concern affected million of women worldwide, and it defined as a condition in which the pelvic floor organ move partially or completely from their natural position and move toward the genital hiatus because of the weakness or stretching of the pelvic floor muscles and the ligament. And of course, the etiology of that, it relates to vaginal delivery, large baby, forceps used during the delivery, or vacuum assisted birth, and prolonged of or a very quick second stage of labor and having multiple deliveries increase the risk of prolapse. There are 4 degrees of the prolapse. As you can see, number 0, that means there is no prolapse, the uterus in its normal position. And grade 1, the most distal portion of the prolapse is more than 1 centimeter above the level of the hymen. Stage 2, the most distal portion of the prolapse is a 1 centimeter or less proximal or distal to the hymen. And this is the 2 stages that we can help them as a physiotherapist. Stage 3, the most protruded more than 1 centimeter below the hymen, but not further than 2 centimeter and less than the total vaginal length. Stage 4, it is a vaginal eversion, is essentially completed, which is she needs surgery. The aim of the study, as I mentioned, I was thinking to find a good evidence base to my patient to help them. So the study was done to explore the effectiveness of yoga poses and Kegel exercise as a way of preventing and treating pelvic organ prolapse. The methodology, I used a case study, and the setting, it was my organization, King Faisal Specialist Hospital. And the sample was 3 women recruited in the study according to the inclusion criteria. My inclusion criteria was age group ranged between 35 to 50 years, educated woman, bachelor degree, because I want them really to understand how to do the exercise properly and perfectly to have a good result. Woman also clinically diagnosed as a uterine prolapse, first and second degree only, with or without stress incontinence, and multipara woman. Exclusion criteria: woman with reproductive tract infection, reproductive tract infection and urinary tract infection, or any other gynecological complication. I used 4 tools as a measurement for my study. The first tool, it is a structured interview questionnaire were diagnosed by myself in the form of closed and ended question, and it has 3 points. The first part, characteristic of the studied woman, the age, educational level, marital status, occupational, body mass index, as well as number for follow-up. Part 2, it was the obstetric and gynecological history as a parity, mode of previous deliveries, and prolapse during stage and type of the prolapse. Part 3, woman knowledge about the pelvic organ prolapse. It composed of 9 items as meaning type, causes, symptoms, diagnosis, complication, preventive measure for reducing prolapsed organ, symptoms, and treatment options. Part 4, it is woman be received a change in prolapsed symptoms since the start of the study, if it is the same, better, or worse. Second tool that I used, it is the review every visit compliance of the patient with the type of exercise and if they do it or not. Compliance in weight reduction, compliance to avoid the sitting in squatting position or standing for a long time, compliance to avoidance lifting heavy things, and compliance to intake food that contain fiber to avoid constipation, and compliance to avoidance of high impact activity and exercise. Tool number 3, we use it pre and post. And this tool, it is called pelvic organ prolapse symptom score, which is discovered by Hagen at 2008, and it composed of 7 items. Feeling of something coming down, discomfort worse when standing, abdominal pain when standing, lower back heaviness, strain to empty the bladder, a feeling bladder not empty, a feeling a bowel not empty. The fourth one, I use it pre and post as well. It has 7 items, which is, we call it the prolapsed organ symptoms. And it has how the patient are able in the last 4 weeks to do the housework without pain and heaviness during activities and entertainment activities, and travel by car or bus for more than 30 minutes away from the house. Participation in social activity outside the home, emotional health, and feeling frustrated. The first case of my 3 women, 38 years old of age, presented with a history of heaviness and discomfort in the vaginal and pelvic pressure for 1 year. Urgency present sometimes, had 1 child, and had restricted her physical activity such as standing up, walking, doing her aerobic class. Second one was 45 years old, had a history of 6-month heaviness of the lower abdominal area and discomfort in the vagina, had restricted physical activities such as walking, standing, jumping, running, and aerobic classes, and tensioning up with anticipation of sex, unable to carry her baby because of the symptoms will become worse, and accompanied with occasional stress incontinence, and had 3 children. The last one, she was 46 years old and history of 5 years of stress incontinence and heaviness in the vaginal area, restricted her from doing housework and carrying her child. It requires her to manually push deeper the protruded organ and to empty the bowel easily, had chronic constipation, and had 5 children. The management, the 3 of them, they were received yoga training and Kegel exercise once per week for 8 weeks in the clinic, followed by unsupervised by phone call follow-up, Kegel exercise and yoga pose at home program for the total 12 sessions they received. After they completed the 12 sessions, they came to the clinic and discharge. These are the type of exercise that we give to the patient: breathing exercise and for the lower pelvic, and do the Kegel exercise, wrist pose and inversion pose and mula bandha. This is a type of yoga of breathing exercise. Wallflower stretch pose and boat pose and shoulder pose and down facing dog pose. These all from yoga. The outcome, as I mentioned at the beginning, by Hagen at 2018, we used the pre and post, the pelvic organ prolapse symptom score. Women perceived change in prolapsed symptoms since the start of the treatment, how they feel before and after. Is it the same, worse? Pelvic organ prolapse impact questionnaire and the clinician observation by anatomical and functional and reassessment of the muscle power. As we can see here, the majority of the patient, they were feeling at the beginning, there is a feeling of something coming down from the vagina, pain in the vagina when they stand up, and heaviness in the lower abdominal. After the treatment, it becomes either occasionally or never happened. The second one, it reveals that there was a highly different between the pelvic organ prolapse impact questionnaire compared to post-intervention. As we can see here, regarding the feeling of frustration, it was more. And regarding doing activity of physical activity that limited them from doing their exercise or aerobic exercise or walking, and limiting them from doing their work at home. So it becomes better after the treatment. And the result illustrated relationship between yoga poses and Kegel exercise with uterine prolapse, self-report, and pelvic floor muscle strength. It becomes, from the majority of them, they measure 2 out of 5 before the treatment. It becomes a 3 out of 5. And the endurance and the repetition and fast contraction, it becomes much better. And the last point, it is about the uterine prolapse. It was mild in the first case, then it becomes never happened. In the second and third one, it was moderate, it became mild after the treatment. The incontinence, it was sometimes in first one, and after the treatment, it is rarely happened. And the second one, she had occasionally, then after the treatment, never. The third one, sometimes, then it becomes occasionally after the treatment. In conclusion, the study finding concluding that Kegel exercise and yoga training program had been demonstrated to be effective in including significant improvement in manifestation of uterine prolapse among women. The practice of yoga encouraged healthy lifestyle and made many lifestyle changes that result in weight loss, decrease in constipation, straining during bowel movement, better stress management, and improved postural alignment. And as we see the previous table, there is a huge improvement in the muscle strength of the pelvic floor muscles, and the participation reported no bulging symptoms and has been able to lead an active lifestyle as they did before the problem. The limitation of the study, it was only for 3 women. So we need to do a randomized controlled trial in the future and larger sample, and we need to do a longer follow-up, like after 1 year or after 9 months, then 1 year, to really make sure it is effective treatment for such a patient. That's all, and